Hi there. In this episode, I am sharing with you treatment options for endometriosis, and I will also share with you self-care tools that you can use on a daily basis to get yourself out of pain, and you can do this at home. Hi, I'm Dr. Gina Terranoni from Holistic Health Journeys for Women. I've helped over 2,000 women and couples get pregnant and have healthy babies over the past 22 or more years. I've helped and supported several thousand women go through pregnancies, postpartum, perimenopause, menopause, pain, everything with holistic and functional medicine. I focus on quick action steps based on research, decades of trainings, and my clinical practice. Please take a second to subscribe to my channel below, and this way you'll get alerts when my new videos come out. And also check the show notes for free resources that can help you to get pregnant even if you have endometriosis. And stay until the end because I'm adding in a bonus material section on how to deal with getting rid of the dreaded endobelly. I hear about that all the time. Why do I have endobelly? So you can also download a free 7-step guide to getting rid of endometriosis pain on the spot. This is like your emergency quick sheet. What do I do right now? I'm in so much pain. Okay, let's get started. How is endometriosis treated? At present, there is no known cure for endometriosis, and treatment is usually aimed at controlling symptoms or surgical removal of the pelvic lesions which occur, and they often reoccur. And in the early stages of the disease, however, there may be a window of opportunity to improve quality of life with healthy lifestyle interventions and pain management strategies. So let's talk about that because there's hope with this piece. Okay, so first, Western medicine. They often will prescribe pain medications to you and removal of tissue. But keep this in mind, this is only a temporary fix, and that's what research shows. Usually, if you have pain medication or removal of tissue, it will keep coming back. The future of the medicine for endometriosis is looking at ovulation suppression. Remember, these options often come with side effects from this type of medicine or even these procedures, and it turns into a vicious cycle of reoccurrence of the endometrial lesions. In addition to helping improve root causes of endometriosis, let's look at holistic medicines that can also help to alleviate the side effects of these Western endometriosis treatments. So like I said in the last video that I highly recommend you watch if you haven't yet, is that integrating Western and holistic and functional medicines is probably the best approach when dealing with endometriosis. Okay, so let's look at Chinese medicine. So Chinese medicine is a natural holistic approach. This is my base. This is what I have my doctorate in, and I always have specialized in women's healthcare. What we do with Chinese medicine, often there's a lot of different tools under the umbrella of Chinese medicine, but often we'll use acupuncture or acupressure, very specific points on the body. There's also infrared patching that can stimulate the acupuncture points, and that's really good for home use when you can't, or you're in so much pain you can't get to your acupuncturist. Also, heat therapy directly on the area where the pain is, and that can help with blood circulation and the pain. Herbal medicine for sure. This to me is one of my most favorite treatments for endometriosis because you can take it on a daily basis and several times a day, and that helps with increasing blood circulation and decreasing inflammation. I have helped a lot of patients reduce the size of lesions and to prevent reoccurrence in the area. Also, one of the best is tied with herbal medicine is doing herbal foot soaks. And so there's very specific herbs that we say invigorate blood. And the nice thing is if you have an upset stomach from just being in so much pain, or if you're on pain medications, then you soak your feet in specific herbal medicine. Yes, Epsom salts can help, but that will not eradicate the issues and the root cause of what's causing the lesions to keep reoccurring for you. And the focus of herbal foot soaks is to break up the stagnation and again, invigorate blood circulation throughout your whole body, focusing on reducing inflammation in the overall body and target specific areas where these lesions may be reoccurring and where they're accumulating. We also look at lifestyle therapies, nutrition plans, stress reduction, and breathing techniques, and cardiovascular exercises. All of this is used in conjunction with either, again, primarily like herbal medicine, herbal foot soaks, but also the acupressure, acupuncture. And there's very specific ways to eat to help with reducing inflammation in the body. And we really dive into that, and that will be in an upcoming episode, so I can get really specific with dietary recommendations for you. Okay, next we're looking at functional medicine. And so functional medicine, again, it's like another natural holistic approach and is looking at whole body person and trying to also work on the root cause of the pain and the problem and the reoccurrence. So often you'll work in or incorporate supplements, botanicals, and herbal medicine. So there's a lot of overlap with natural medicines, with holistic, functional, and Chinese medicine approaches. And then also Ayurvedic medicine, of course, can be worked in there as well. They also look at lifestyle medicine and food therapy. So really it's about getting to the root and working with you or working with a woman who's experiencing these discomforts and this pain. And really, it's a lot of detective work to see what is causing this. Why did this start for you? Because it can be different for different women and different people who experience these lesions and this horrible disease. Let's see, best steps to take if you are ready to absolutely get relief from endometriosis. Let's talk about this. Ideally, I would recommend finding a Western gynecologist who's open to working with a holistic doctor. And then we talked about this in the first episode, where integrative medicine is in the best treatment for the patient. When you work with a Western doctor, they can help with diagnostic tools. They can track improvements of holistic treatments that you're doing. You can say, maybe have a laparoscopy and clear lesions out, and then you start your holistic treatment. And then maybe you go back in 3 months and you can see what kind of progress you're making. Also, they offer pain relief when it's interfering with your life, because you should not be suffering as much as you probably are. And no one should go through life without relief from pain. So that's the number one goal, is to get you out of pain, out of discomfort, where you can control and you can live your life. Because I know that a lot of my patients, a lot of my clients, they have to call out of work, then it creates stress at home, it creates stress with their boss, or maybe they even have to leave a job. Let's prevent that from happening, okay? So the benefit of Western and Chinese medicine, according to Jane Littleton, and she's an endocrinologist and licensed acupuncturist who's written extensively on this topic, and she's worked with thousands of patients. What she says is to monitor with ultrasound before and after around 6 months of treatment, locate the endometrial tissue, as well as see improvement. And you also get to learn how to adjust the patient's treatment plan accordingly. So it's perfect. It's like this perfect combination, the best of all medicines. In this case, one medicine is not superior to another, not even close. Okay, so let's look at some self-care tips that support endometriosis and pain relief. There's been a good amount of proposed research regarding lifestyle interventions, but minimal has been done so far. Rather than wait for a study to tell you that, for example, getting better sleep will help you, how about just trying it out? It will improve your overall quality of life and will possibly help you to get relief from endometriosis and the pain as well. It's really important to think about what things can you avoid specifically during your menstrual cycle. And this helps a lot with pain relief. So you do want to avoid sexual intercourse. This can absolutely inflame and aggravate any lesions that are there. Avoid swimming. Any kind of like pool or hot tub or anything like that, you're just too vulnerable down there. And even women who don't have endometriosis, I recommend avoiding sexual intercourse, avoid swimming. If you're in a pool, there's chlorine, there's chemicals, all of that gets into your body, and you're specifically and very vulnerable during that time of the month. And also avoid excessive and strenuous exercise. And I understand because I've worked with triathletes and many athletes over the last couple of decades, and they have a really hard time working it around their schedule. That's something that over time can be improved with some help and a little bit of guidance. And then absolutely do not use tampons. Use the period underwear or use big pads if you have to double up. Definitely do that. You can even put on your bed if you're worried about bleeding through in the nighttime, then you put down those sheets. And this is temporary because you can get relief and there will be less bleeding and there will be less cramping, and we can eliminate or severely reduce the pain levels. Okay, so you've got to keep that in mind. Okay, avoid excessive emotions in general, and this can interfere with proper blood circulation throughout the entire body. So it is a little bit of a vicious cycle because pain causes stress in the body, and then stress could cause more stress with relationships or work situations, or just overall like anxiety, depression, and just feeling down all of the time. It is really important to get support for yourself. Eat foods that are steamed or cooked and avoid greasy and hard to digest foods. Focus on dark leafy greens to allow for getting proper amounts of B and C vitamins. Also, this one is very important, and I think it seems too simple. It's so impactful. Practice deep breathing exercises daily. And I recommend at a minimum when you wake up in the morning to sit, or if you're uncomfortable or if you're having an episode of pain, lay on your side or go into yoga pose and child's pose, probably not on your back, but more like the kneeling, and you can Google that pose, or I can put a link in the notes. But practice deep breathing in and out, filling your belly nice and big. Exhale. And really sink into it. Don't rush these exercises. I would spend a minimum of absolute 5 minutes in the morning, 5 minutes at bedtime, and then gradually increase that to longer durations. And again, like stress reduction, you can't spend too much time on stress reduction, especially with pain. So this could be, again, breathing exercises, but also meditation is incredibly helpful, 20-30 minutes a day, and then working up to more time. And aerobic exercise when you're not in pain, okay? Don't deplete yourself. If you're in pain, don't power through it, because that can be damaging to your body. It can also be damaging to the flow of blood in your body. So look at something, if you're in pain, look at something that's more gentle, like practicing yoga, not power yoga, and either gentle, slow flow or restorative yoga when you are in pain. If you're having cramping, you're having back pain, you're having digestive challenges, all these things, headaches, nausea, bloating, endobelly, all these things, look to yoga, okay? And if you absolutely can't do anything, drink a cup of fresh ginger tea with hot water in there and just sip, 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 okay? You can get through this, but it does take a little bit of prep. Also get proper and deep sleep. You may need to overhaul your wind down routine to get better sleep. Poor sleep is often associated with pelvic pain, and endo is like the biggest cause of that diagnosis. Okay, so let's talk about bonus tips for endobelly. Do not eat processed foods. Drink raw, steeped ginger. So you're not eating raw ginger. I mean, you could chew on it, but you're going to pour over boiling water and let it steep for about 5 minutes. Drink that before every meal, and also sip on it throughout the day, especially if you've got pain. Don't eat raw food. Eat lightly steamed veggies. Add in deep belly breathing exercises daily for at least 5 minutes in the morning and in the evening. So in this episode, we looked at the known options for treating endometriosis with Western medicine, holistic, Chinese, and functional medicine. And also I added in some self-care tools and recommendations, and I covered those so you can get started today. Pick one of those things, and you might have to rewatch and just kind of get to this part, but pick one of those things to start adding into each day. And you don't have to be in pain. In fact, if you're in pain, yes, use them. But if you're not in pain, do the exercises, do those practices, because that can help prevent flare-ups. In the next episode, I will dive deeper into endometriosis with specific, more self-care tools and present a couple of patient case studies of women who were able to get relief from endometriosis and also get pregnant. Stay tuned for that, subscribe, and check the notes for all the free resources to help you get out of pain. I will see you in the next episode.